We are quite an orthopedic center here. We have subspecialists in spine, we have a spine team, we also do joint replacements, we have a hand and microsurgery team. So we cover all bases. Things that are niche to SJMC would be, for instance, the spine team does a lot of different approaches, and they do microdiscectomies and things like that, daycare, spine surgeries and stuff. So I do general orthopedics. My niche area is joint replacements. I do a lot of what's called fast track knee replacements. So what I do is I get patients to walk almost immediately after surgery. So I get patients operated in the morning, walking on the same day. The advantage of this is that you have lower risk of things like deep vein thrombosis and pulmonary embolism, which are blood clots in the leg, which can be dangerous. So I've started actually doing this about 15 years ago, when there was a worldwide movement moving towards fast-track surgery, early mobilization, reducing the risk of surgery. I've also done the first daycare total knee replacement in Malaysia. So what we did was we had a patient come in the morning, get operated in the morning, be able to walk to the toilet by the afternoon. Because I see a lot of Indonesian patients, so they would like to shorten their hospital stay. I also have developed ways of wound closure which does not need the patient to come back to the hospital to have the stitches removed, so there are no stitches. So patients can actually take their tapes off after a stipulated period of time. This can be monitored via teleconferencing. So if I have a patient who's gone back to Indonesia, and then they can consult us via teleconference, and they decide that, I'm doing very well, I probably want to save that trip. Do I really need to come back to Malaysia just to remove stitches? That would not be necessary. So we'd send videos to them, and we can actually have them remove their tapes under supervision during the teleconferencing.
Basically, why we have orthopedic hospitals, because this is actually the first orthopedic hospital which is complete, meaning from the emergencies to the ward to the ID or ICU, even at the operating theatres, that we have 5 operating theatres. So it is like mini hospitals, but we're very specialized in treating the orthopedics. The reason why we choose or build this hospital is, one is to get a very more focused treatment for orthopedics, and then the one, because the people or the surgeons who are chosen to be here is basically all our experienced surgeons with the subspecialty experience at least 15 years, not the specialist, the subspecialty experience at least 15 years. Like myself is already 25 years. Early 2000, they start doing the anterior approach, which is from in front, whereby it is a small incisions and they will not cut any muscles at all, and then able to replace. And then the advantage of this actually is the fast recovery, less painful, and you don't cut any muscle at all. This is why the reason that the recovery is very fast. Then after 1 month, they should be able to go back to work. If it is office work, I'm talking about office work, they should be able to do that.